Okay, in this group you will be seeing the last part of the whole story we have been talking about in the 4 previous modules. Just to begin very quickly, once the fertilization occurred, the fertilization of the ovum with this one sperm cell, the embryo begins to develop, and in this stage we will begin to talk about pregnancy and birth. So what you see here is the zygote. The zygote is the name for the fertilized egg. This is a mouse zygote, but it's the same for humans. They don't look very different, not different at all. Then what you see is when this fertilized egg undergoes mitosis, 2 cells, then 4 cells, then multi-cells, and then this structure is called morula, and finally, the blastocyst. The blastocyst is one very primitive aspect of stage of the embryo, and what you see here, this is not real, but it is a computer simulation. What happens? 10 to 13 days after the ovulation, the embryo attaches to the placenta. Okay, the placenta is a tissue in the uterus, in the inner uterus wall, that will be the main source of food and energy for the embryo throughout the whole pregnancy and the fetus and the baby. So it gets attached through a stalk, and this stalk will be forming later the umbilical cord. 29 days after the ovulation, what first appears is one groove here. It's like an invagination, something like it is like a pliegue, okay? And this groove will be holding the neural system. This is the first organ that develops, the whole neural system of the baby. You can see here the actual size on day 23 is around 3 millimeters. Few days after, the eyes begin to form, and very, very special, the heart begins to beat. So even if it's only tiny, 3 millimeter big embryo, the heart is already beating. Then 44 days after the ovulation, you see this kind of creature. If you watch some images of other animals, like for example pigs or even fishes, they look very, very similar at this stage of development. Both pigs, mice, fish, frogs, all their embryos look very, very similar. So what you see here is the embryo. This is the umbilical cord. Here you will say, okay, it's very big, but you have to consider that the embryo is very small. So in comparison, the cord is not that big. It's normal. And the heart already has the 4 chambers. This creature already has an intestine, hands here, and the feet begin to develop. Later, what happens? 54 days post-ovulation. This is like a little more than 65 days pregnancy. You are like already 2 months of pregnancy. You don't feel anything, but in the baby, the fetus, the brain begins to move. Okay, it begins to move the muscles, the lips, the ears, the eyelids are formed, the heart is finished. 18 weeks, this is around month 5 of pregnancy, post-ovulation. The fetus already has phases of sleep and being awake. It has a preferred sleeping position. It's around 12 to 14 centimeters long, and it develops a very fine hair that covers the whole skin. This disappears later in the development of the baby. 24 weeks post-ovulation, the fetus already weighs 540 grams approximately. The lungs begin to develop, but it would not be able to breathe. This is why when a baby is born so prematurely, it has to be held in a special device, an incubator, and to have artificial breathing assistance, etc., until the lungs mature. and the fetus can begin to distinguish lights and sounds. This is when they begin to hear the voice of the mother and of the father, and they identify them. This is around 6 months of pregnancy, and then already by the end, 38 weeks post-ovulation, the fetus is around 3 kilograms, is ready to breathe by itself outside the uterus. It turns upside down, and on week 40 the labor begins. What does it mean? The labor, what we call in Spanish el parto, has 3 stages. The first stage has an initial phase, the latent phase, when the baby begins to push with its head against the cervix to begin to dilate. Okay, you begin with the contractions, very, very smooth contractions. Then second part of the first stage is the active phase, where you see that the head is already pushing and dilating the cervix. The cervix begins to get erased, and this is when you feel the harder contractions. In the second stage, the fetus enters the vagina, okay, the birth channel here, and comes out. This is what is called the crowning of the head. Is when you can see from outside how the head with the hairs appear outside the opening of the vagina, okay. The baby is born. Once the head is out, the rest comes very easily because the head is the biggest part of the baby. And in the final stage, what happens? This is very, very important. Most of you forget. The stage 3 is the last part of the birth, of the labor, when the placenta and the whole rest of the umbilical cord is expulsed. Okay? Of course, you will be very busy with your newborn baby and you will not be feeling this, but if for some reason this stage is not completely finished and pieces of placenta stay inside the uterus, it can become very, very dangerous to the mother. It can get an infection and many, many complications. So this is a very important stage where you expulse the placenta. You will have probably seen, if any one of you has cats or dogs that have had babies at your home, that if you observed in detail, there is a phase where the placenta is expelled, and normally the animals eat the placenta. And we don't do that except for some strange people of some special orientations that believe that eating a placenta is some kind of ritual or something for the health, but that's not what is most common nowadays in our Western society. So the first stage begins when you start having contractions. This is a further explanation of everything I just told you. The second stage begins when you're fully dilated, and this is the pushing stage, when you have seen the movies, to push and push and push, so the baby is born. And the third stage begins after the birth of the baby and ends with the delivery of the placenta. So what happens if you're a teenager and get pregnant? So what you normally answer to that, no, it's very dangerous, you die. You die, the mother dies, the baby dies. That's not true, okay? There are many, many risks. The risks are more related to socioeconomic factors, but something common, more common in teenagers than in adult mothers, is having bleedings during the pregnancy. Eclampsia. Eclampsia is a very risky condition for the mother and for the baby. If you suffer eclampsia during pregnancy, I know adult women that have had eclampsia. The baby has to be taken out as soon as possible to preserve the health of the mother and of the baby. It's a very risky, high blood pressure. Cephalo-pelvic disproportion, what does it mean? That a very young teenager, and I am saying like girls, puberty phase, girls like 12 years, 13 years old, they should really not become pregnant. But if it happens, their pelvis, their hips are still very, very small, and in comparison to the head of the baby, there might be complications. So in some cases, the cesarean section is indicated in those cases. Doesn't mean that any of you, if you're a girl and you're watching and you become pregnant, I hope you don't, but if you're 15, 16, 17 years old, your development of your hips is already very similar to what you will be when you're an adult. So this is not a major complication. Preterm birth, baby born before the normal date, and low birth weight, okay? Babies that even if they're born on time have a lower weight. Why? Because a girl that is growing like an adolescent needs a lot of nutrients and energy, and it is something she is taking away from her baby. It's more difficult when you're a teenager and you are pregnant to have both very well fed, but of course it depends. If you are going regularly to the doctor for controls, you have a mother that takes care of you, etc. Of course, this will not be of a concern for you either, okay? So the risks are really related to socioeconomic factors rather than biological factors. As I said before, vitamin deficiency and anemia are very common things. So in Argentina, sadly, 1 of 6 pregnancies are mothers until 20 years old. 90% of the teenage mothers abandon school. 30% leave the school as soon as they know they're pregnant. They think they will not be able to finish it. Pregnancies in teens of lower socioeconomic status are 17 times higher than high socioeconomic status. Why? Because there is a lack of sexual education, a lower age of sexual initiation, a lot of curiosity, and mainly and sadly a lack of other motivating projects. So sexual education schools, like we are doing here, is very, very important. Okay, hope you found it interesting, and if you have any question, you can watch this video again or ask me in class.